A little boy with a serious illness is on his way to a normal life now, thanks to a procedure done at Duke.
While stem cell transplants using umbilical cord blood are becoming more common, doctors say this one was unique. CBS North Carolina's Maggie Newland joins us with Thor's story and why it's what's next.
Sean, Thor Uran's family came to Durham all the way from Minneapolis because of Duke's expertise when it comes to cord blood transplants. The hospital actually performed the first unrelated cord blood transplant in the world back in the 90s. But doctors at Duke have only done a handful of transplants exactly like this one. He's an active little boy with a big smile and a habit of blowing kisses. And at 1.5, Thor Uran is already showing brotherly love to his little sister Lila.
What about Lila? Oh, that was a good one.
They're going to be connected, you know, in a very unique way.
They literally have the same blood.
Just weeks after Lila was born, the blood from her umbilical cord was transplanted into her brother, who's battling a rare genetic disorder called chronic granulomatous disease, or CGD. It puts him at constant risk of infection.
There are certain bacteria and funguses that he can't fight off. He couldn't play in leaves, he couldn't play in dirt, he can't be in fresh water.
Given the type of disease that Thor has, I would not have expected a normal lifespan for him.
Thor's best chance for a normal life was a bone marrow transplant, but doctors couldn't find a match. So the family, who lives in Minneapolis, looked into using cord blood and turned to Duke. At the time, Justine Uran was pregnant with Lila.
This was actually very interesting and almost cutting edge at a number of levels.
Before Lila was born, doctors were able to determine the baby did not carry CGD, and her cord blood was a match for Thor. Justine and Dustin left their jobs in Minnesota and moved to Durham for Lila's birth and Thor's transplant. First, chemotherapy destroyed Thor's immune system so he could accept his sister's cells.
It's definitely the hardest thing we've ever been through, watching him like that. We were in the hospital for 42 days.
Now, a few months after the transplant, Thor is back to his old self, but still waiting for his new immune system to get stronger.
So far, everything looks fantastic.
Dr. Vinod Prasad says cord blood transplants generally cause fewer complications than traditional bone marrow transplants, and the match doesn't need to be as perfect.
Cord blood units have been used to save now thousands of children with many different diseases, including leukemia, lymphoma, immune deficiency, other inherited diseases.
Thor's future looks much different than it used to.
He would be very limited without the transplant, but now, I mean, there aren't any limitations, or there won't be.
He'll be just like a regular kid.
And he has his doctors and his sister to thank.
He better be nice to her when they're older.
And Thor has had a few complications, but his mom and dad say they're not major setbacks. He actually had surgery just this afternoon after he developed some fluid on his heart, but I just talked to his parents a little while ago. They say he is now out of surgery and he's doing fine. And as you can see, he's just an absolute delightful kid to be around. If you want to follow Thor's journey, we have a link to his Facebook page on our website, WNCN.com.